In this lesson, we'll take a look at the peripheral nerves and the plexi that form them. So we had said in the previous lesson that we have 31 pair of spinal nerves that come or emerge off of the spinal cord. It turns out we have many more nerves in the body than the 31. So what I want to show you now is where do they come from? So this is a really good picture. If you take a look here on the left, they're just showing you the 31 pair of spinal nerves that come off of the spinal cord. If you remember from the previous lesson, we had said that there are 8 cervical nerves, right? 8 pair. 12 thoracic nerves, right? 12 pair, 5 pair of lumbar nerves, and 5 pair of sacral nerves, and then 1 coccygeal nerve. And that's how we came up with 31. So if you take a look over on the other side, they're going to kind of expand this out a little bit. Notice what happens here, guys. Some of the nerve roots that are formed will intermingle with one another. If you take a look right here, see how they kind of combine? This is what we call a plexus. So the literal translation of a plexus means a braiding, right? So the nerve roots come together forming like a braiding, and then from this plexus many more nerves arise. So it turns out we have 4 major plexi in the body. There's the cervical plexus. Something like 8 nerves come off of the cervical plexus, right? So we have 8 new nerves coming off of this plexus. The brachial plexus has 20 plus new nerves coming off of it. That's going to go down into our arms, right? Brachial. Notice the thoracic nerves, however, they don't form a plexus, right? They don't braid together at all. So there is no such thing as a thoracic plexus. These nerves just kind of go out between our ribs. And we actually sometimes call the thoracic nerves intercostal nerves because they're between the ribs. Okay, so we're going to see a cervical plexus, a brachial plexus. Then going down a little bit further, right about here is a lumbar plexus. And then right in front of our sacrum is another big plexus called the sacral plexus, where a bunch of nerves emerge there. This is not even all of them. This is just a small portion of them. So, if you take a look at the note pack there, I have a kind of a listing of some of the important nerves that I want you to know. Like I said, that is not comprehensive at all. There's many more nerves. If you're interested, you can look them up. I just wanted to show you some of the more important clinical peripheral nerves that are out there. So let's take a look real quick. So the cervical plexus, just going back a minute, that would be like right about here, is going to have 8 different nerves coming off of it. You can see some of their names here. You don't have to know them. There's only one that you're going to have to know, the phrenic nerve. These cervical plexus consists of 8 nerves that come off, which generally supply the neck. I didn't put there, I'm sorry, the neck, the upper shoulder, the upper limb, and then there's one nerve especially that goes to the diaphragm. That nerve I do want you to know, it's called the phrenic nerve. Right, so that phrenic nerve will go right down our neck, through our thorax, and to the diaphragm, and it stimulates the diaphragm so that we can breathe. The second plexus I just want you to be aware of is called the brachial plexus. That's all of this right here. You can see it's heading down towards the arm. And as I mentioned, like 20 something nerves come off of the brachial plexus. I picked what I thought were the 5 most important ones. The first nerve goes right to this compartment here, our anterior compartment. Remember in here was your biceps brachii, the brachialis, and then the coracobrachialis. This nerve, the musculocutaneous nerve, innervates those muscles, right? So if somebody had damage in their musculocutaneous nerve, right, they would have trouble doing like a biceps curl, that type of thing. They would have weakness. The median nerve, median we know means the midline. This goes right down the middle of our upper limb. It even goes through the carpal tunnel here into our hand. It supplies all of the flexor muscles of the forearm except for the flexor carpi ulnaris, right? So it would do like your pronator teres. It would do your flexor carpi radialis. It would do your palmaris longus, flexor digitorum superficialis, right? All those muscles that we had studied, all of those muscles would be innervated except for the muscle going over the ulna. That's going to be picked up by another nerve. This median nerve, I didn't put it in your notes here, but just so you know, actually goes through the carpal tunnel, and it does sensory to your thumb, your second finger, and your third finger, and even half of your ring finger. So when this nerve is pinched in the carpal tunnel, this is what causes carpal tunnel syndrome. So it's the median nerve entrapment that causes carpal tunnel syndrome. The ulnar nerve comes down the medial side of your forearm, right? So it actually goes around your medial malleolus right here. It actually goes right around there. There's a little groove in here. It always feels like a little piece of linguine to me. I feel right in here. There's the ulnar nerve right inside there. This is going to go down and innervate that flexor carpi ulnaris, and then it even goes through a little tunnel here called the tunnel of Guillain into your pinky and ring finger. When you whack your elbow and you get that lightning bolt into your pinky, you're hitting actually the ulnar nerve. That sometimes becomes entrapped at the elbow and people have to have surgery. The axillary nerve you could probably figure out is going to go to the axilla, and we'll find it in the axilla, and it supplies the deltoid muscle, and then one of the rotator cuff muscles, the teres minor. Sometimes people will injure their axillary nerve if they not lay, if they put their body weight on crutches and the crutch pushes up into their axilla, their armpit. That can compress the axillary nerve, and the patient would have trouble doing like abduction of the shoulder, right? Because the deltoid is a very powerful abductor, right? It does abduction. So that happens sometimes when people, again, use crutches incorrectly. The other nerve that sometimes gets damaged is the radial nerve. This goes down the back of our arm, down the back of the forearm here, but it's very superficial around the lateral malleolus. This bump right here, the radial nerve goes like very superficial around it. Sometimes people will get injured radial nerves when they're like in a fight. Let's say some hard object is about to hit the person, so the person puts their arm up like this to block their head, and then the object hits them right here, like a bat or a bottle or something like that, and the radial nerve becomes damaged. And now what will happen is all of these extensor muscles on their forearm become weak, and they can't like do this. They can't bring their wrist back, they can't bring their fingers back, and they end up with a condition known as a wrist drop, right? Because these muscles are so weak and the anterior muscles are unopposed. So they have this. So hopefully the damage will correct itself. It could take a couple months and they start to get that extension back. Okay, so these are nerves that you definitely will see in clinical practice. Now, the intercostal nerves, also known as the thoracic nerves, as I mentioned before, they do not form a plexus, right? See these nerves here? See how they just go out between the ribs, right? There's no braiding, right? So there's no such thing as a thoracic plexus. If you see that on one of my exams, thoracic plexus, don't pick that. That's wrong. There's no such thing. Okay, so be careful with that. These do not form a plexus. These supplies the muscles and the skin between the ribs. So like our intercostal ribs and the skin over the ribs. That's what they're supplying. The lumbar plexus, like down over here, has a bunch of nerves that go to our pelvis, the external genitalia, that type of thing. The one nerve that I thought maybe you should know is called the femoral nerve. This is a nerve that goes down into our thigh and goes to the quadricep muscles. The femoral nerve, we need that to kind of lock the knee into extension when we're walking or climbing upstairs. So sometimes individuals will have damage to their femoral nerve, and as a result, their anterior thigh muscles will be weak. Finally, guys, the last plexus forms right in front of the sacrum. It's called the sacral plexus. Again, there's a bunch of nerves that come off of there. The one main nerve that I want you to know is this big guy right here. It's the biggest nerve in the body. It's called the sciatic nerve. Right, it runs right down the back of our thigh, and then right above the knee, it divides into three separate nerves, each one going into a different compartment. Okay, so the sciatic nerve itself, as it goes down the back of the thigh, supplies our hamstrings. Then right above the knee, it divides. One part or one division goes into the posterior leg compartment. It's called the posterior tibial nerve. It does like the muscles, the gastrocnemius, the soleus, the plantaris, popliteus, right? Flexor digitorum longus, flexor hallucis longus, tibialis posterior. If you remember all those muscles in the posterior leg compartment, they're going to get the posterior tibial nerve. The deep peroneal nerve goes into the anterior leg compartment. If you remember the tibialis anterior, extensor digitorum longus, extensor hallucis longus. And then finally, the last nerve of the sciatic nerve branch is the superficial peroneal. That one goes over to like your fibula, that where the head of the fibula is, and down into the lateral leg compartment, where it's going to do your fibularis longus and your fibularis brevis. Okay, so that concludes this lesson on the peripheral nerves. Like I said, there's more than 31 nerves that come off the spinal cord.